I came in initially for the neuropathy in my feet, had both the pain and had lost a good bit of the feeling. And a lot of that had been associated, I was treated for cancer about 2 years ago, and some of the side effects of one of the drugs was towards the end of one of the treatments, it caused some fairly severe neuropathy, and then in combination with that, I developed some good bit of pain in my feet. It was almost to the point, at one point before I had some additional medication for it, where I could hardly walk. So it was fairly severe. And after that, after I'd finished the majority of my cancer treatment, I did some physical therapy and a little bit of other stuff to kind of help me with my walking and redo some muscle memory. I take Lyrica to help with the nerve pain, and I had been referred over to the Roger C. Peace and did some physical therapy to help with the walking. Over there they did some anodyne treatment, which is with infrared light. Basically it helped some with the pain, but it didn't, it's been almost, before I came over here, it's about 2 years. And that's kind of with the cancer treatment, a lot of times they tell you the majority of your recovery is going to be in the first year, and you may get some in the second year. And sometimes they don't give you quite as much hope beyond that. So I really wasn't willing to say this is how I want to stay. So I came over to investigate what the program was and what kind of the information I got, the use of the HECOMED horizontal current machine and some of the cold laser. It was some new items for me, and I was willing to give it a try. We did the evaluation the other day, and I think I'd gotten about a 40–50% improvement on the feeling. I'm able to walk a lot better. My gait has improved. I've had a lot of people say that they've noticed that part of it. So I've lost 15 to 20 pounds, and it's not really been trying to lose weight, it's been some of the adjustment to the diet and maybe doing the exercise a little bit better. I've been pleased, getting additional sensation back in my foot. It helps me with the balance, and I think I'm probably a little more optimistic about getting some continued improvement. My desire would be to get off the Lyrica medication and not have any thoughts about my feet. Going through that and having it where you lose a lot of the sensation, you don't realize, well, you realize it going from being able to walk real good to almost being handicapped. When I initially had the treatment, I can remember when I walked in the Walmart with kind of a cane, and I could get about halfway. I could get almost to the back of the store before I had to sit down, before the pain built up enough where it would get some relief if I stopped and took a break. So there's a big difference. I'm pleased that I came over here, and I think it gave me, it definitely improved my feeling in my feet, and I think it's improved probably my cardio health in combination with that, with some of the lost weight and some of the various things. trying to get my good cholesterol up and some of that. So in general, it's been, I think, an improvement to my overall health. So I'm pleased with it, and I'd recommend it to other people.